We are going to be talking this afternoon about those speech language probes. Um, when the policy first went out, I had several calls, actually quite a few calls about dynamic assessment and also about play therapy, which really kind of surprised me. Dynamic assessment did not, because even though it's been around for like 8 years or so, even more than that probably, I could understand if people hadn't heard of that. But the play-based therapy and assessment, I was really kind of surprised about. So the first thing I want to say before we get started is I think in some cases, because there are so many changes, it's kind of overwhelming for you guys. And because of that, I think you're questioning yourself and questioning what you know. And I'm here to tell you, you already know this stuff. You really do. But we're going to go through it, and hopefully that'll make you feel a bit more comfortable and confident about it. And hopefully, too, it will also show you how you can really gather a lot of good information for your students so that you'll know exactly how to write those goals for therapy. Because, as you guys know, if you've been keeping up with the research on ASHA, the new research is showing that we should not be using evaluations, testing, a standardized testing to determine our speech goals. The speech goals should be determined by the issues that the student is having in the classroom and what the assessment data shows us about those issues, and then addressing it more in a narrative therapy format than just working on isolated discrete skills. That's a topic for another day, but I really do think you're going to find as we go through this that you know a lot more than you think. So we're going to be talking about eligibility just really quickly, go over that again, and then talk about the language probes and the options that you have. And then we'll have some time for question and answers. We do have a couple of video clips, and depending on how we run with time, we might add a couple more as well. Okay, so the very beginning sentence for the language eligibility criteria says this statement, and we added culture, socioeconomic status, language background, and dialect for the eligibility committee to consider, because all of those factors can make a student look as if or appear as if they have a language disorder when maybe what they have is a language difference. So it's our job, and that's what we've been trained to do, to determine that difference from a disorder. And hopefully by using this information, you'll be ready to do that. One thing that I want to mention too, because as I'm doing these trainings and putting out these webinars and videos, I never know for sure who has heard what. So one thing I just want to mention is that my job at the State Department is to make sure that SLPs around the state are using evidence-based practices that are current and supported by research. If, because several people, including some really good friends of mine, have said, why didn't you just leave things alone? We were happy with the way things were. And the answer to that is a simple one. The research didn't support it, evidence-based practice didn't support it. And once that was apparent, and I realized that we were way behind, probably 15 years behind what the rest of the country was doing and what IDEA said that we had to do, then that's when I knew I didn't really have an option. This has been a big lift. It's going to continue to be a big lift in some cases, but it's what we have to do. And I never doubt that you guys want to provide the best services possible. And hopefully that's what we'll be doing once you feel more confident and comfortable with the evaluation process. So if you remember, Each eligibility category, including language, is divided into 3 parts that correlate with the 3 prongs of eligibility. So the first one, the first item in each case, directly relates to identifying that student as having an impairment. That's what we were taught to do in school, and we're very good at it. We can identify impairments, very readily. But there's an added piece as an educational speech language pathologist that we have to consider, and that is that academic piece and the educational relevance. So that's the reason the identification of the impairment is only one piece. There are 3 parts to each eligibility section. And for the first section, for language, we say that 3 or more speech language probes or standardized speech language assessments are performed. If the student can't participate in that type of assessment process, then we have the option of using the functional communication assessment summary. We're going to be doing a webinar on the assessment summaries. I think that one's tomorrow. We have them scheduled just about every day, but that one I think is tomorrow. And we'll talk then about the functional communication assessment summary. But just remember that that's an option that you have instead of doing the language assessment. We only use the functional communication assessment summary for artic and language because, like for fluency, social communication disorder, and voice, those students are typically verbal and can participate with the assessment process. So it's just for artic and language that you can use the functional communication summary. Okay, so what you have to do is choose 3 of the 5 options that are listed here. And we have some qualifiers for some of the options. The first option is assessment on a norm reference test of both receptive and expressive language with a diagnostic accuracy, and that's the sensitivity and specificity, of 80% or higher. So we're looking at that composite score and the cut score that aligns with the test manufacturer's recommendation. Only composite test scores may be used, and individual subtest scores may not be considered. Now that is one of the speech language assessments. It is not a probe, so we're not going to be going into that further today. Language sample analysis, however, is considered a probe, and if it results in a score that's at least 1.5 standard deviations or more below the mean, then that indicates that there's an issue. And we're looking for at least two measures of productivity and complexity. What's going to happen with the language sample analysis today is that we're going to defer that until next Friday, January 13th. Dr. Brandel has contacted me and said that she feels like we need to have a refresher on the language sample analysis because honestly, in the 4 years that we've had the SALAD lab, only about half, of the SLPs in the state, so around 250, 275 of the SLPs have actually tried the lab and uploaded samples and that kind of thing. So people who haven't tried it before and are trying it now are making some errors that they don't intend to make, like they're prompting too much and that kind of thing. And they're also maybe having some issues with uploading the samples and interpreting the results. So she's going to give a refresher course on the 13th. It'll be a 2-hour course from 12 to 2. We will record it, so it'll be available for viewing later. And so that's where we're going to just go ahead and wait and talk about language sample analysis all at that time. When she does that. We also have Karen Haynes providing some quick webinars for us on language sample analysis. One thing that I do want to mention is that as we have gone through and discussed language sample analysis, actually for the last couple of years, therapists have said that they would like to learn how to do that on their own, so they're not dependent upon the WVU lab. And I understand that and support that. And so this spring, we're going to be doing a training as well for SLPs who are interested. What we'd like to do is train the trainers, and then have you, help train people in your county. And instead of providing money to the WVU lab, we would provide money to your county to purchase salt, sugar, whichever program you'd like to use. I think sugar is completely free. So that you can use that on your own to do your own reports if you choose. So that's just a little aside. Dynamic assessment is one of the things we're going to be talking about today. And with dynamic assessment, you're talking about test, teach, retest. You guys do this all the time in therapy. It's just kind of a way of doing stimulability. You do it in our TIC, but to have it applied to language, I can see where in some cases it's maybe a little bit confusing. But the big thing that you're looking for at that point is how easily a student learns a language skill. And like I said, we're going to talk more about that in just a minute. We have some video resources for you as far as that's concerned. D is a little tricky. Because we wanted the diagnostic accuracy that we listed in item A, the 80%, we understand that there are going to still be some tests in your test battery that don't meet that diagnostic accuracy, criteria, but they can give you some really good information. It shouldn't be used solely. These tests should not be used solely as one test that you're going to be using for determining eligibility, but you can gather some really good information from those tests. So we wanted to give you the opportunity to use those tests, but what we decided to do was say, if you're going to use those tests, that's fine, but you also have to make sure that you're going to use one of those tests in item A that have that 80% diagnostic accuracy for sensitivity and specificity. The reason we did that was because a lot of these tests that don't have it test for things like auditory processing. They might test for just semantics or morphology, and we want to be able to use those tests as well. So that's the reason that one's listed. So if you choose to use one of those tests, you automatically have to give a test that has that 80% diagnostic accuracy. The final probes that we have are case history, observation, parent and teacher interviews, and informal assessment. And for students who are preschool age, just remember that we're talking about social communicative impact. We are not talking about academic impact for those students. So speaking of academic impact and educational performance, that is prong 2, and that is number 2 in all of your eligibility criteria. And the eligibility criteria says that the disability that you've identified in number 1 adversely impacts educational performance. And that can include vocational or social communicative performance in the case of preschoolers, and also social performance for other students as well. But the reason I keep mentioning preschool as social communicative is because that is, we don't look at academics. I've heard stories about students going for birth to 3 transitions, or trying to enter kindergarten preschool for the first time, and being told they didn't qualify for therapy because there was no academic impact. So I'm going to keep stressing that in preschool, we're looking at social communicative performance. And I actually received some calls and some emails wanting me to define social communicative performance. If you think about it, That's has been in policy. It's been in policy and in the guidance document since 2015. So that's not anything new. Um, so, um, like I said, just think about what you know and trust yourself for that. Um, Pam says, in consideration of social communication, only apply for preschool. No, it can apply for upper grades as well. If a student is not participating socially in class because they are afraid they'll be made fun of, if they're being bullied, if a student who has a fluency disorder is having issues and not wanting to talk, that is definitely affects their educational performance and definitely counts. So it doesn't always have to be their grades. It doesn't always have to be their academics. It can be social for all levels, and it can be vocational for those upper grades. Um, oh, okay, I see Nicole's watching with you. That's great. Okay, so we're going to go on to the next one. Okay, and then number 3 relates directly to that third prong, and that third prong is that the student needs special education. And you would think that that's just going to be an easy checkbox, yes, on the eligibility committee form. But in reality, you should be thinking about that for each student as well. Every student that you place, you should be thinking about all 3 prongs. And I think one of the reasons people are concerned about the changes is because, we're talking about the 3 prongs and we're saying you have to prove that adverse impact. But you guys, the adverse impact has been on there since 2015. It's in the last policy that we had in 2017. So that's not anything new. The fact that you're being told you have to prove it is, but those 3 prongs have always been there. So that's what this third prong is the need for specialized instruction, special education. If the student can have some stimulation from the classroom teacher, from the parent, that kind of thing, and they don't need the specific skill set of a speech language pathologist who has specialized training that no one else in the school system does, then of course they should receive therapy through an IEP. But if they don't, that means they don't meet the third prong and they shouldn't qualify because they don't meet all 3 prongs of eligibility. Um, as I've been training and doing webinars, I've been talking about the comprehensive language assessments and comprehensive assessments for every eligibility category. And as we've done that, um, I've talked about all 4 components, which are the academic activities, academics, tests and measures, speech language probes, and then speech language tests and measures. What we're talking about in this session is strictly the speech language pathology probes. But one thing I'd like to point out to you is the fact that if you look back in the last guidance document, which is 2015, you'll see if you look under components of a comprehensive assessment that dynamic assessment's listed there. Um, language sample analysis is listed. A lot of these things are already there and have been there for quite a while. So, this is not something new. It's something that's been around for a while. And another thing I forgot to mention for those of you who haven't heard it is that I'm very fortunate to be in a state coordinators group through ASHA, and we meet every year at the ASHA convention, and we also have monthly calls so that we can keep each other up on what's happening in other states. In order to change our guidance document and our policy, we looked at documents from 16 other states. And the reason we did 16 was because I knew from our group, the ones that I respected their information that they had shared. I had done research on my own on their information, and I was able to interview them and find out the issues that they had had. So I don't want you to think this is something that I just picked out of the air. or saw somewhere and thought, oh, this would be nice if we could do this. This is something that's being used in other states. A lot of states, I can think of at least 6 to 8 for sure without looking at anything, that used Virginia's guidelines, because they are heavily research and evidence-based. And if you've heard of Marie Ireland, or if you've seen her on any of the SLP summits, that, there's free sessions that they offer. She has done sessions on there about evaluation and that kind of thing that have had 18,000 participants. So she's an ASHA fellow. She's, her work is stellar. And she's also worked with McLeod Crowe as far as their norms and how it affects the eligibility process. So I just want you to know this is information that we're using that has been tried and tested, and it's very. I feel very confident in using this information and saying that this is going to be appropriate for us to use. So if we think about the probes that we have here, um, the case history is one, interviews, narrative language samples, stimulability, dynamic assessment, um, play-based therapy, and criterion reference tests and tests and checklists. And you can add informal, tests to this, um, all kinds of information you can gather as part of a probe. Okay, I see Rachel has a question, I think. I just evaluated a student and she scored above average on her standardized assessment. I also did a language sample where everything came back below average. Is this where clinical judgment team eligibility decision comes in? Yes, it is, but it also comes in when you look at all three prongs, Rachel. So make sure that even though you're not basing everything just on test scores, make sure that you have maybe some interview information or information that you've gathered from the teacher that talks about the educational impact. Um, and if the student is old enough, you can interview them. Make sure you've done some observations so you have some proof about that educational impact. Your test scores aren't the end all be all. They really aren't. As a matter of fact, if you look at the options A through E, you could conceivably do an assessment on a student and not do a standardized test. So just remember that standardized test does not determine eligibility. And IDEA says we can't base eligibility on just one test. So make sure you have other supporting information. And another thing I wanted to mention too was all the research. Since I think I've looked at so much research, to be honest, I'm getting a little bit of it confused, but I think it was clear back to 2004 when the Leaders Project did the research that demonstrated that 78 score that all the states were using. All the states had set an arbitrary score cutoff for eligibility. That wasn't appropriate. The cutoff for each test is not the same. And so that's the reason, we're not putting as much emphasis on the standardized tests too, and the norm reference tests, because they were never designed to determine disabilities. They really weren't. And we use them in that way because we feel like we have to have something, but that's not what they were designed to do. They were designed to, identify some pieces of language that the student's having difficulty with. But taking that information and saying that affects them in the classroom, that doesn't always translate. That's the reason we're talking about narrative therapy might be the best, because saying that you're working on plurals and possessives, because that's what they missed on a test, that doesn't translate to the difficulties that they're having in the classroom usually. So we're going to have a different mindset as we move into this. We've been trying to prepare everybody for it for several years now, talking about educational relevance, talking about different service delivery methods and that kind of thing. But as we move forward, we'll continue to talk about it and continue to think about the ways that we can improve how we identify our students and provide their services. Case history, what we are doing with the guidance document, and I apologize for the guidance document not being out. We've been working on it since this summer. Actually, been working on it since before this summer, but as you guys know, we have a huge scope of practice. There's a lot of information that had to be changed and updated, and it's not all that I do here. So we're trying to get it ready so it'll go out in finalized form this month. We're hoping mid-month. Um, but one of the things we're going to do is have a OneDrive that's available for everyone in the state to be able to go in and look at forms and that kind of thing. Because we're putting them in guidance, it means that they're not mandatory. And that's one of the reasons that the items were taken out of policy, like our checklists and our developmental norms and that kind of thing. So since it's in guidance, it means we can update it whenever we need to, as opposed to policy, which is a huge process. Um, but instead of making a guidance document that's going to be like 200 or 300 pages, which this could potentially easily be, it's already 122 pages as it is right now. Um, we are going to do the OneDrive so you can go in, pull up documents, have access to the electronic files. So if you choose to make your own or tweak what we provide as examples, you're welcome to do that. One of those things is a case history. You guys probably have case histories that you're using in your county or in your local education agency. And that's how you're going to be hearing us refer to counties moving forward. Instead of districts or counties, we're saying LEA. Um, but that case history can provide some really valuable information. Now, I don't know about your all's counties, but the county I was in, we saw case history information for kids who entered preschool or kids who transitioned from birth to 3. Typically, we had that case history information. But for kids who entered kindergarten, even kids we picked up in first grade, we didn't always have access to that information. And that information can be extremely important. If there's a history of middle ear infections, delays and milestones and that kind of thing, that gives you a whole lot more information than having them identify a picture on a test. So just know that that case history for the upper grades, of course, is not going to be as appropriate. But for those kids who are, let's say, second grade and under, and you guys might determine you want to do it for different grade levels, that's fine. But for second grade and under, for instance, it could be a really valuable piece of information. The nice thing about the case history too is you just have to print it off or make a copy of it and send it home. It's not something that you have to go through and complete and that kind of thing. So any of you guys who have SLPAs or supervised SLPAs, these are some of these things, these probes are going to be things that they can do for you to help support you. And we're giving them that freedom in the update to the SLPA guidance document. So case histories, like I said, we'll provide some examples, but then you guys can determine exactly which ones you want to use. Interviews. Interviews can be used as it's the fifth choice, choice E. Interviews is one of the things that you can use. And it's not just saying how's the student doing. It's really asking some specific questions. And we have here again some examples you can use, but you might have some that you've found in other places. As I've been looking for information and trying to gather information for the guidance document, there is a whole lot of stuff available in on Teachers Pay Teachers, because other states have been using these types of things for years. So they've developed interviews and questionnaires and that kind of thing that you can, in a lot of cases, get for free and maybe tweak and do your own thing with them. But your interviews can be not only with the classroom teacher, but also interviews with the principal, if you're going over, some test data with them of the like general summative assessment and that kind of thing. But it can be with the parent, of course, and it can be with the student. Now, some people have asked, for the parent and the teacher, we automatically have to get input from them anyway, for the teacher evaluation report and parent information. And yeah, you can get some information from them that's going to be pertinent. But these interviews, you don't have to be in person. You can do them by phone. This is where you're just going to be gathering some additional information above and beyond what they put on those forms. Those questions. And, I know some counties have said that they want to develop new forms that would kind of include the interview format. That's fine, as long as you have the information to support and show that section on the summary assessment, then you have the information you need. So here again, we're going to provide some examples, but that final draft, that final format that you use will be up to you guys. This is just some information, some quick information about language sample analysis. And one of the reasons I try to do this is because when we put the policy out for comment, of course, we got a lot of speech therapist comments, and rightfully so. The first time that we wrote the criteria, it was too confusing. There were a lot of reasons for the changes to be questioned, and I was thankful that they were, because that gave us the opportunity to go in and make changes. But one of the things that was mentioned that they really questioned was using language sample analysis, and in saying that it's something that was used years ago, it's not appropriate anymore, it doesn't really give you any information, and all we really need is for SLP to identify the students using their professional judgment. Well, of course, since we have to follow IDEA and Policy 2419, we can't just use professional judgment, but I want to make sure that you understand too that language sample analysis is not something from the past. As a matter of fact, it's been something that's been proven to be extremely functional and helpful for students. It's time consuming. It can be. As far as trying to do the analysis yourself and the transcription. And that's the reason we tried, we developed a salad lab. But I just, have some articles here, some information that talk about the importance of language sample analysis. And that is one of the probes. So diagnostic accuracy of distinguishing a difference from a disorder or an where sample analysis is used in conjunction with standardized testing. And one thing to remember about that too is that it's very good for helping determine difference versus impairment or disorder as far as students who are English learners. So I'm always getting questions about what kind of evaluation should I do with a student who's an English learner? Well, one of the things that I would recommend is a language sample analysis. Because it's considered the gold standard for identifying students who have difficulty in L1 and L2. And the nice thing of it is that the Salad Lab, we have provided through the grant funding additional funds for WVU to purchase the other languages, so that not only can they interpret English and transcribe and analyze English, but they can analyze other languages as well. And that gives you a really good indicator if there's a delay in L1. So, and just the fact that it's a sensitive indicator of language impairment, I think is really important for you to remember. Here's the information about it being the gold standard for English learners, and difficulties with narrative comprehension and production have been linked to students' difficulties with reading comprehension, writing, and social achievement. And you're going to be hearing a lot more about reading comprehension and writing and the science of reading and that kind of coming up because that's the new department focus. That's what we're going to be focusing on this spring. Our role in that can be greatly helped by using the information that we gather through the language sample narratives. So I just wanted to point that out because I do think that's important for you to know. And honestly, I think it's because I'm really cognizant of being the oldest person in our department now. And I think when I saw that it was something used in the olden days, is how it was described, I just thought, oh my goodness, people are thinking I'm just using that because I'm old too, but that's not the reason. So anyway, I see that Pamela has said specific info. I want, as a teacher evaluation report, parent report, case history, or do we have to use certain forms? In some ways, that question should be posed to your director because, if you have a lead therapist in your county and they've worked with the director and given permission for that teacher evaluation report that you guys use to be changed, then that's absolutely fine. In our forms book, we don't have a teacher or a parent evaluation report. Those are kind of developed within the counties. So that's something that, is a county level decision as far as we're concerned. As long as you're gathering that information, you can use whatever you need to gather the information that you need. This is just some information about the Salad Lab, the link to it. If you haven't been on it and you've been trying to avoid it at all costs because it just feels overwhelming, please try to get on that training next week because I think that will help. They do have videos available to tell you every step of the way what to do. I keep hearing rumors, and it's really kind of frustrating because the rumors are being said by SLPs in the counties, and they're telling their directors that the reason they don't use the Salad Lab is because it takes 2 months for transcriptions to be done. That's not the case. It's 2 weeks. 2 weeks is the turnaround time. Now, if you've turned something in, and in some cases I did hear where they weren't uploaded correctly and the SLP didn't realize it and they didn't get it back in the 2-week turnaround. If you haven't heard anything within that 2 weeks, please contact them again and say, did you receive my sample? Because it should not ever take them 2 weeks to make that turnaround happen. Um, and then there are some other resources in the Salad Lab as well. There are tests that can be checked out if you're looking at purchasing new tests and you want to test drive them first or look at them and get more information than you can from looking in the catalog. They will send them to you free of charge and give you a shipping label to send them back. They also have iPads with resources on them. So please take advantage of the Salad Lab, at least while it's still available, and um, give it a chance. I think you'll be surprised at the information that you'll get. And in some cases, that information is going to be what helps support your decision one way or the other. Dynamic assessment. Dynamic assessment I can see, stepping back and looking at it, I can see why sometimes it could be either too nebulous for us because we like things to be black and white, or it could just be overwhelming because we feel like there's a lot of things to learn. But I want you to know that it's something that you do all the time. You just don't call it that. But it is a type of assessment that's used to evaluate their ability to learn a skill. Um, this type of assessments are often used to evaluate their ability to learn new communication skills. So what I've done, and I will send you, I didn't think about that. I will make sure to give you a link to this PowerPoint um, or email it to you from the attendance sheet so you can have the direct link. But ASHA has a portal for dynamic assessment that has information, and it also has videos. There's a 4-part video series. We're going to watch number 1 today, but there's a 4-part video series about dynamic assessment that was produced by ASHA. And each one is less than, I think it's less than 18 minutes. But we also have available a recording of the training that Dr. Brandel did a couple of years ago on dynamic assessment. That's the reason sometimes it gets frustrating when I hear people saying they've never heard of it, because it's been on ASHA for quite a while. But we also did a training on it and did a 4 area training on it and did a recording. So we have the recording, we have the PowerPoint, and Dr. Brandel's recording does show some examples of students who are, participating in a dynamic assessment. And I think a lot of it is really helpful. So make sure you get those links. And then this is a link to a video that's on YouTube about dynamic assessment with students who are English learners. The new term is not English language learners anymore. It's just English learners, ELs, but the information's still the same. And in our Leads team group, we have all kinds of free resources that I downloaded from Bilinguistics that have information on dynamic assessments for students who are English learners. And here again, this is a really good format to use for those students, because if they can quickly learn a skill that you teach them, then they don't have a language disorder or a language impairment. They have a language difference. Maybe a little bit of a delay, but you give them some instruction, they can pick up on it. That's not somebody who should have an IEP. So that's the reason dynamic assessment is so important. I also went through and was just trying to find some information on dynamic assessment to share, and I'll show that to you as soon as we watch this short video. Stop sharing a minute. Make sure I get that audio on. Okay. Okay.
Hi, I'm Liz Pena, and I'm going to be talking about dynamic assessment today. So what is dynamic assessment? First, my speaker disclosure is that I am a professor and associate dean of faculty development and diversity at the University of California at Irvine, and I'm receiving compensation from the American Speech and Hearing Association for this module. So today we're going to talk about how we compare dynamic assessment to other dynamic assessment approaches, or to other assessment approaches. We're going to talk about what makes dynamic assessment dynamic, and what we should use at the dynamic assessment pre-test and post-test. Also, we're going to consider how dynamic assessment differs from assessments, including standardized assessment, observations, and response to intervention. Some overlap, but there are some differences as well. So what makes dynamic assessment dynamic? Well, one of the things that makes it dynamic is that the focus is more on the learning process rather than on how kids perform on a standardized test or a probe. So it's really important to be observant of what children are doing during that learning. We look at the amount and nature of the examiner investment. So how hard did somebody have to work to get that kid to make some changes? It's very interactive, so you make decisions in the moment about what might help the child perform at a higher level. And we're really focused on the process rather than on child outcomes. In terms of selecting a test, what you want to do is select a probe or a measure that really samples the language skills of interest. We want it to be something that is sensitive to short-term changes. So a lot of examples of a certain kind of item, for example, might be a better way of probing a child language skill than a broad-based measure. And we want to be able to capture emerging knowledge and performance. So it's not, I want to be able to rate something on like a scale. Is it close to the target? Is it exactly the target? Is it completely different from the target? So that helps us to capture what children are learning in a very short amount of time. So how do dynamic assessment approaches differ from other approaches? Well, here's a chart that shows a summary of some of these. So for standardized assessment or static assessment, participants are passive. So you go in, you test, and you're not supposed to interfere with the child's performance or with the child's answers. You're not supposed to cue them. So the examiner has a very neutral stance on what they're doing. The examiner's role is to really observe what the child can do pretty independently. Standardized tests are also used to describe needs or areas of difficulty, and it's given in a really standardized way so that you give that measure the same way every time you give it to a different child. In dynamic assessment, it's a little bit different. So both the child and the examiner are really active, and the examiner is actively participating and intervening and supporting the child learning during that language assessment. So you're watching and hypothesizing and then getting in there and trying to make that child's performance a little bit better. The goal is to describe modifiability or how the child can change. And so the protocol is really flexible and adaptable. So you have permission to go off script and to make hypotheses about what you think the child's needs are, try to do a mini support for that process or that procedure, and then see how they do with that. So how is dynamic assessment different from observation? So observation is a really important aspect of assessment, but in observation, usually examiners are more neutral. So you're kind of in the room, observing, watching, and developing hypotheses about what happens and why that happens, and it helps you to compare performance across contexts. In dynamic assessment, that examiner is going to be more active, and so they may get into the child's space to intervene to try to help the child perform better on a specific linguistic task. So that's one difference from observation. How is dynamic assessment different from response to intervention? And response to intervention, I think, has a lot of similarities to dynamic assessment. So we look at child responsiveness in both, we look at child learning in both, we want to document intervention that leads to change in both, and we look at outcomes in both. But where they differ is in the approach. So dynamic assessment starts with testing and then teaching and retesting. In response to intervention, the focus is more on teaching and then testing and then reteaching. In terms of the number of sessions, dynamic assessment uses relatively few sessions. So you're just trying to look at emerging knowledge or ability to change, and you do it in 1, 2, or 3 sessions typically. Response to intervention is usually over several weeks, so 10 weeks, 15 weeks, a whole semester. And so you're looking at whether children are retaining that information and using the information that they're learning. Dynamic assessment can be used or is typically used in special education to determine whether a child has a language impairment or developmental language disability. And RTI is used as a tiered intervention within the regular education domain. And then the focus is a little bit different. In dynamic assessment, we look at what works and why it works that way. And in response to intervention, we're looking at what tier or what level of support works best for that child. So now we've explored the concept of dynamic assessment, and in the next activity, we're going to review some examples of these concepts. So what is dynamic assessment? Let's review some examples. So here we have a girl, Vicky. She's 6 years old and she's in the 1st grade. Her teacher referred her to the speech language pathologist because she's concerned about her language and literacy skills. The speech language pathologist gives her the test of narrative language. The scores indicate difficulty with narrative comprehension and narrative production. What is this? So this is an example of a static test. So it's a standardized test. The examiner administers the test according to the manual, same way that you would give it to any child, and you score the stories and the questions, and you obtain a standardized score for comprehension and for production, and then like a more comprehensive score as well. And this score helps us to determine whether the child has a developmental language disability. Next, SLP might observe Vicky during reading instruction, and she notices that Vicky has difficulty decoding words. So here, the speech pathologist is doing an observation. So through these observations, she's able to make hypotheses about Vicky's instructional needs that are based on observations, that are based on what she sees in the classroom setting. Next, we find out that Vicky tests in the lowest quartile on a reading test, and the school recommends Vicky for the early interventions in reading program that's focused on letter sound knowledge, reading fluency, and curricular vocabulary. And so this is a standard curriculum that's a tier 2 curriculum. And after 16 weeks, she's going to be retested to see if she's on target for reading. So this is an example of response to intervention. The 16-week program is a 2-tier intervention that's focused on getting Vicky's skills up to speed. And then the SLP notices also that Vicky's TNL stories are not well organized. And so the SLP works on stories that include elements to include a problem statement, an attempt, and a resolution. She observes and reports on Vicky's strategies during that teaching session and the kinds of supports that she needs to improve her stories. And this is an example of dynamic assessment. So the focus is on the process of learning and what the child needs in order to make changes in her story. So in the next 5 minutes, what you need to do, or what is planned for you to do, is your turn to practice. So here's a plan statement. So what you want to think about: the who, the what, and the how. And think about a child that you're currently testing or have tested recently. Is there a diagnostic question that you can answer using dynamic assessment? What is the focus of the concern, and what are your hypotheses regarding how best to support learning in this area? And then how can you test this out using principles of dynamic assessment? Let's try your plan. So spend 5 minutes at work putting your plan into action. So dynamic assessment can be really powerful to determine what works, what doesn't work, why a child might be having difficulty, and you use the dynamic assessment to test that out. If you don't have somebody that you're working with right now that this could work for, maybe explain this process to a colleague. How can they use dynamic assessment to differentiate between language difference and language disorder? And here you might jot down some reflections. What went well in your plan? What happened? How can you make improvement? So think about what your teaching target was, how did you test and retest, what was the child's response to that teaching, what did they pick up on, what was difficult, what else do you need to know to make a diagnostic decision, how does it inform your testing.
Okay, so there are three more pieces, three more modules from ASHA that talk about dynamic assessment. And like I said, I will also make sure that you get the links to Dr. Brandl's dynamic assessment information as well. I was really kind of, like I said at the very beginning, I was really kind of surprised when I received some questions from special ed directors, but the special ed directors were representing their SLPs saying, what is play-based assessment? Just because I kind of thought that that was a pretty standard method of gathering information on, especially preschoolers. But here again, that's another reason you don't just assume. So with play-based therapy, and that's what you're going to do to get your play-based assessment information, is when SLP plans speech or language activities around a toy or a favorite activity of the student. And that's where, if you haven't received or haven't gotten a reinforcer assessment for the student, it's a really good thing to send home, not only to use in therapy later, so you can plan activities around things that they like, but if you have to offer reinforcement of some kind, knowing what they like is extremely helpful. And the activities are and the targeted skills are built around um, activities or toys that are interesting to the child. And this Dabbling Speechy article that is hyperlinked down here, these subheadings are part of that article. I just wanted you to see what type of information is included in that. There are types of play that can be targeted, 5 stages of play-based therapy, and how to use toys in speech therapy. That's all available in that article that says what does play-based speech therapy look like. And what you're going to be doing is gathering information while you're doing those plays activities and taking that information and anecdotal notes that you've collected and use that information to talk about what the student does, how they interacted, how they requested things, how they shared, were they able to participate, those kinds of things. That's the type of information you're looking for. So I think the big thing to remember about play-based assessment and any of the informal assessments that you may want to use, those kinds of things are absolutely important and give valuable information. So don't just think that it all has to be from a standardized norm reference test, because that's what we're used to using. These are just some other articles that I looked up very quickly, honestly. And I thought there was some really good information from Jenna Rayburn Kirk, sorry. And she's the one who does Speech Room News. I like her information because it's usually easy to understand and very direct. And in both cases of the articles that are listed here, she provided pictures and that kind of thing. So I think that can be helpful as well. She does try to sell things, and one of them, I think there's a play-based documentation form that she maybe sells. I didn't even look to see how much it was because that wasn't the purpose. The purpose is just trying to get some tips and some ideas and some methodologies for completing those types of assessments. And then there is a research article strategies and tools for evaluating and assessing infants and toddlers. And play-based therapy and assessment has been around for a long time as well. And for those students who can't maybe participate because they don't have the patience or the attention span, that kind of thing, to do standardized testing, but they can communicate with you in some way. They can, you know, do more than somebody who's going to participate in a functional assessment summary. This can give you a lot of really good information. So what we're going to do now is watch just a short, I think it's maybe 13 minutes video from Tony Linder. Tony Linder is one of the leaders in play-based assessment. And this is just a short video to see how she talks about play-based assessment. Oh, it's 15 minutes.
Let's hear what's that triangle. Oh, look what she made.
Sorry, a little bit.
Triangle. Yes. Let's hear what's that triangle. Oh, look what she made. Triangle. Yes. Let's hear what's that triangle. Oh, look what she made. Oh, look, a body. Now we need to make some legs for our cat.
I don't know about you guys, but I can't hear that very well. So I'm not going to make you sit here and listen to it. I apologize for that, but the link is down here. You can try to listen to it on your own computer and see if it does a little bit better.
You gonna make a leg? You're gonna repeat it.
She had some other videos. This was just like an introductory one that I wanted to try. So I apologize. Okay, the other type of tests that we're going to be talking about as probes are going to be criterion referenced assessments. And you guys learned about criterion referenced assessments in college. And you know what they are. You just maybe have forgotten how to categorize them as opposed to a norm reference test. So with criterion reference assessments, they can be standardized, but they are tests that measure an individual's performance against a predetermined criteria of performance standards. So instead of getting like a standard score for these types of assessments, you're going to be getting things like you're going to be rating a skill as being either mastered, potentially emerging, or not used. You might often have a percentage instead of a standard score. And I'm sorry, not a percentage. These tests don't provide percentiles or standard scores. They're going to give you like a pass fail, or like I said, the mastery, not used, emerging, those types of things. So these tests can be checklists in some cases. Some of the checklists that are used and some of the developmental milestones that are used tell you skills that are developed at certain ages. And that gives you a framework to work with within about where that student's skills are without having that standard score to use for placement. So with criterion referenced assessments, that can be things like the communication matrix. If any of you guys have given the communication matrix before, you know that it's an assessment that either you, the parent, and a lot of times we always had teachers help complete it as well, complete, and you're deciding and determining whether or not the student is using a skill, if they've mastered it, if they've surpassed it, and if it's emerging or not used. With that, then you get a determination about what level they're working on, and that gives you the information that you need to know if they're functioning at 18 months. This is what we can expect. This is where we start. This is how we move forward. That's going to be different than what you would get with a norm reference test. It's going to give you a standard score. The communication matrix is typically for students who are functioning between 0 to 24 months. And it's appropriate for students who don't have a fluent form of language, who are minimally or nonverbal. And it can be for students of any age, but just remember they should be functioning around 0 to 24 months. With the communication matrix, for those of you who haven't heard, we have communication matrix intervention modules now that are available on the Department of Ed website. And the link to that is here. The modules, we have everything from this is how you administer the matrix to interpretation. And then for each level of communication, we have resources. So if we have time at the end, I might get on and just show you that really quickly, because it's just a whole website full of information for you to use. We also are planning on doing some trainings with it this spring, where we're going to be having SLPs and their teams, if possible, work with a team leader who's going to go through the process, the whole process, help them determine, where to start with communication and that kind of thing. And that's all work that we've tried to gather um, for years and years. So anyway, that's going to be a really good source for you. Tricia says, can we use grade expectations which appear on the IEP as a criterion referenced assessment? I don't think it's really considered a criterion referenced assessment at that point, Tricia. You can use the college and career readiness standards or the alternate standards. You can use those as like a criterion referenced informal assessment. To say where the other typically developing peers are functioning and where your student is functioning. So I think those standards will give you a little bit more information than those grade level expectations do. Another criterion referenced assessment is the EASIC 3. It is a 5-level inventory. They test things like pre-linguistic skills, semantics, syntax, morphology, and pragmatics. And it's for students who either are developmentally disabled, have autism, or have a moderate to severe cognitive and language disorders. These things are important to remember too, as far as if you have a student that you're going to use the functional assessment summary with, using these tests, these type of rating scales where you are, not having to have the student participate, you're having the adults, determine this information. This is how you can fill out those boxes that are in the functional communication assessment summary using these types of assessments. We have EASICs that are available for checkout at the Romney lab, accessibility lab. And we also have some at WVU that can be checked out through the Salad Lab for anyone who doesn't have them. If you haven't given it before, it can be a little time consuming at first just because of gathering some of the materials. But it gives a lot of really good information and so much more information than you would have if you just tried to do a parent interview and just tried to do anecdotal information from the parent, because there's only so many questions you can ask that parent and in the amount of time you have, and this provides some really specific information for those areas of language. Once you have done, selected which one of these probes you're going to use, you're just going to put all of your information here in this third column where it's speech language probes. You can use, any of your informal assessments that you decide to use. Like if you decide you want to do a basic concept probe, and you just have a checklist of basic concepts and you want to check which ones they have, that's absolutely fine. If you want to do a rapid automatic naming test and you want to, show that information, that is all where you would put that type of information in the speech and language probe. And just remember that, like for dynamic assessment, um, you've got a relatively simple description here to circle for that information, but then in your report you should explain more thoroughly, how they did on that dynamic assessment. Just one reminder about the assessment summaries in general. They are not mandatory. They are not part of the, let me back up a minute. I said they're not mandatory. We are recommending to special ed directors, and our guidance is that they do use these. They are not part of the evaluation process, however, and they are not part of your evaluation report. They are simply a method to visually support where you say the student is functioning and give your eligibility committee a visual representation of where the student is functioning. So they can quickly look at all 4 areas that you gathered information on with the academic activities, academic tests and measures, the probes that we just talked about, and then speech and language tests and measures, that you can show them how they are functioning, their comprehensive functioning in all 4 areas by using this form. I know in some states they laminate these forms and determine, show circle the descriptions as they go through the evaluation report, and then show the eligibility committee their form, and they discuss based on what they see on the form, and then they dry erase it and use it for the next person. So your special ed director will determine whether or not to include these. I know some of them are, until the forms committee gets the updated forms out. Some of them are having you include these because they want to show that you used the updated norms for making the determination. And just remember that when we're doing these, that you're looking for areas that are moderately or substantially impacted. So this is, that's all that I had today. Of course, I thought we were going to watch the video, but do we have any other questions? I've been trying to get them as we go along. But do you have any questions? If you feel more comfortable asking, feel free to unmute and let me know what you want to ask. Will the PowerPoint be available? Yes, Abby, it will be. As a matter of fact, I'm going to give you a link right now to a folder that I've been using for my trainings that has all of my training information in them. And I'm just going to drop this PowerPoint in that folder. So you'll have everything all together. Let me find it real quickly. Okay, so in your chat box, I have just placed the link for the survey to get a certificate. And you can either do the survey itself or you can do the QR code. You do not have to do both. The link I'm putting in here now is to that resource folder. And as soon as we get off this call, I will upload this PowerPoint to that resource folder for you. In that survey, I think there should be a question about what we can use. Sorry, hold on one second. What if there, let me see, I lost my train of thought. Let me see if I can get it back in just a second. Andrea says, how do we get access to the new forms we're supposed to be using? The new forms will come out, if you're talking about the IDEA forms, the IEP forms, those will be released when the the IEP form committee has those ready. As far as the forms that are going to be involved as part of the guidance document, the access link to that OneDrive will be in the guidance document. And I will, put that out on the listserv as soon as the document is ready and been approved. It will go out on the guidance document and then you'll have access to everything. In the meantime, the summary assessment forms, I sent those out to the leads and I also sent them to special ed directors. So you should be using those already. Okay, Pamela says when 3 language summary categories show mild but 1 is moderate, where does professional judgment come in? It depends on which area is moderate, to be honest. If you have mild um, effect as far as the, let's see if we can pull this back up. If you have mild areas in the academic, then that shows that they don't have that academic impact, and that means that they're not going to meet that second prong. So it just depends, Pamela, on which area you're talking about. Your eligibility committee is the one who's going to make the final determination. I'm hoping that that's going to be helpful for you guys because, I know that there are some cases where you go and the teacher's really adamant that they need therapy. But if you can show them they don't need it, then hopefully that'll be helpful. Same thing with parents and vice versa. If they're not wanting therapy, but you can show them that there's a moderate to substantial impact in all 4 areas, then hopefully that will make your conversation a little easier. So, and Andrea, I will do that as soon as we get off. If you didn't get any emails today, then I will make sure that we get you on that list. I know you asked me to the other day, but I think I was out of town when I got that message. So I will take care of that. You didn't? Okay, then we'll make sure we get that taken care of. Will there be assessment summary document for fluency? Yes, there is. And actually it's going to be, it's located in that resource folder that I just put the link to, and we'll put it in there again. It's there. The only one we don't have an assessment summary for is social communication disorder. And one of the reasons we didn't do that one was because, number one, Virginia didn't have one. And I, was trying to just use ones that had been, trialed and been proven to be effective and appropriate. But the other thing is with social communication disorder, you have to do so much proving that it's a global impact, that it, affects them everywhere they go. And you have to rule out so many other things that I felt like, by the time you've done all that, you have a pretty good indicator of, yes, they qualify or no, they don't. So that doesn't mean that later on we may not either run across one that we feel is appropriate or develop one our own. But for right now, that's the only one that doesn't have one. Any other questions? Make sure that you go ahead and complete the survey to receive the CEUs. I'm not CEUs, yeah, the CEUs, the certificate. Make sure that you complete that. I want to post that link one more time. Make sure that you post that by this Friday at midnight. So we can make sure to get those certificates to you next week. This session is approved by the licensure board, and you'll get certificate maintenance hours for ASHA. It won't go on your ASHA registry, but you can use it when you check that you've completed all your hours. And if you're ever audited, you'll just need your certificate and the PowerPoint, which you'll have access to. Okay, well, if there aren't any other questions, then like I said, I've given you the link to the resource folder, and I'm going to go ahead and upload this PowerPoint to that resource folder right now. So thank you guys very much for your attention and for your questions and participation. And if you think of other things that we can do to help support you through this, I mean, a lot of people keep saying, when's the guidance document going to come out? Well, the thing of it is I can't possibly explain every single thing that you're going to need to know within that guidance document. So it's going to be helpful, and we are trying to include as much information as possible. But just know that it's, there are going to be other things that we need to do too to support. So just let me know, what we can do to help with that. Jennifer, Poland, you have to be recommended by your director. If I get that recommendation, I'll be happy to do that. Okay, well, you guys, thanks so much, and I will talk to you soon. Thanks so much.